I'm from Queens, and so the biggest difference between rural versus big city, I would say, is access. So this VA covers the whole Upper Peninsula as well as northern Wisconsin, so the area of reach is very different. Traveling sometimes is up to 4 or 5 hours away, so having access to telehealth is very, very nice and very different than what I was used to. Here, it's kind of a way of life just so that we can make care accessible to as many veterans as possible.
Being able to also learn the rural culture and the things that happen in rural culture that support veterans has been very helpful. First, the community really supports the veterans, and so that changes the way that they see kind of themselves in the world that they're in. So they feel supported already. Then they come to the VA, and the VA employees are very professional, very respectful. You can tell they genuinely care about their patients in ways that I may not have seen in other places.
The main reason is our culture here at Iron Mountain VA. Whether you're a trainee, a volunteer, a staff member, it's not about a paycheck, it's not about punching a time card, it's about something bigger than yourself. And I think we all believe in the mission, which is quite simply to take good care of veterans in a holistic way. Sure, we do deliver that cutting-edge, top-notch medical care that they deserve, but I'd like to think that we do that with a smile, and that is just reflected in everything we do here. And I feel that veterans pick up on that as soon as they roll into the parking lot. And that ultimately is why I think our patient experience scores have been so favorable.
Now in our own department, our providers have been very helpful. I see them always consistently try to work patients in, just because they travel from so far, and so usually if we can see them, if we can work it in, even if they show up at a wrong time, we will, which has a couple of different benefits. One, it helps with patient experience because you're getting a good experience, you're getting fit faster, but also it opens up the slots so that somebody who's pushed back a little bit further can be seen sooner, and so what that does is it helps our access.
The services that are offered to me here is occupational therapy, physical therapy. I got a room here. I've been treated great. It's a 5-star for sure in my book.
The other thing I'd add to our success is the training programs, and that is just a nice way to bring people into town that may not be from around this area to finish their training on a short-term basis, and then realize how much they love the area and the people and the team here as they get this top-notch training and get their credentials to take on a real job.
My preceptors, they're all wonderful. They know how to teach a student very well and help me to develop as a competent clinician. All of my current preceptors have kind of started as externs here, and so what that tells me is that the care that we give here is so good that after training is done, they want to stay.
How does it make me feel shaping the next generation of therapists and nurses and so on? Makes me feel good. If they get something out of working with me, it makes me feel real good. And he recommended me for this. Didn't really know what I was getting into, but I trusted them. They're a very professional team, and they work good with one another. And it's been all around very, very good experience.
It's a little bit harder to get people to come to a rural area than it is the big city, and if people aren't from here already, it can be a little bit hard to get people to stick here. And so I think these programs for the VA here are absolutely essential.
So we tend to cast a wide net and try to encourage good candidates to take a leap of faith and move great distances or experience a new lifestyle when they join us here at Iron Mountain. The good news is that oftentimes when one does take that leap of faith, they find that they made the right decision, and our retention rates are good.
The VA also has a lot of unique programs that you're not going to find in a lot of other places. So it provides kind of a holistic approach to mental health in some ways. It's not just focusing on therapy. There's also a lot of other supports that come around from that, which makes it a little bit easier to do the therapeutic work. I love veterans. I love being around them. I really want to help support some of the struggles that I know are really unique to veterans, and it's been awesome. I absolutely love it. I come to work every day, and I'm excited to come to work and love working with the patients.
Nurses are, if you got a question, you need something, they're on it right then and there. They don't mess around. And yeah, there's very good staff working here. Very nice, polite people. And they haven't kicked me out yet.